CenterWell Senior Primary Care, the sponsors of this segment. They're simplifying the annual enrollment period process for you. I know it can get complicated. I spoke to a doctor to break it all down. Dr. Wakefield, welcome back.
Well, nice to see you, Rocky.
Always good to see you. We're talking annual enrollment period. It is that time. So let's just educate our viewers on what that means exactly.
So every fall, current Medicare patients receive an annual notice of change, which is a letter outlining upcoming changes to their coverage. Medicare beneficiaries are then eligible to make changes to their coverage during the annual election or enrollment period, or AEP for short, which runs from October 15th to December 7th. Any changes they make will then take effect January 1st.
Now, what kind of changes can they make during this period?
Well, AEP is the only time of the year when you can pick a new Medicare Advantage or prescription drug coverage plan. Depending on where they live, seniors can do a number of other things during this period, including switch from original Medicare to Medicare Advantage, buy a Medigap policy to help pay for original Medicare, switch their Part D prescription drug plans, or opt out completely.
Now, what's the difference between the annual enrollment period and the open enrollment period? I'm sure a lot of people ask about that.
Absolutely. Medicare Advantage open enrollment period, or OEP for short, is from January 1st to March 31st. This period now has more restricted options. First, to participate in OEP, you must already be enrolled in a Medicare Advantage plan. Then you're limited on what you can change. For example, you can switch from Medicare Advantage back to original Medicare, join a Part D prescription drug plan, or switch to a different Medicare Advantage plan. But you can only make one change during OEP.
Now, why is it important for seniors to make sure they enroll during AEP versus OEP?
Well, despite calling itself the open enrollment period, OEP is quite restrictive. Seniors who want to explore more options and feel free to change their minds more than once should really participate in AEP. For nearly 2 full months, you can do your research, consult professionals, or to ensure that really you have the best plan in 2023 that meets all your needs, including coverage for your own primary care physician. Think of OEP more as a chance to take corrective action if you feel you've made a mistake during AEP.
Okay. It is a very complicated topic, but so important for our seniors to know. So thank you guys for keeping them up to date and healthy.
It's my pleasure. Yeah. If viewers have any questions or want to learn more, visit CenterWellLasVegas.com or call the number on your screen to find really the nearest CenterWell Senior Primary Care Center. Our care teams are here to help you answer all your health-related questions.
Thank you, CenterWell Senior Primary Care, for sponsoring that segment. They have 11 locations across the Las Vegas Valley. So for more, head to CenterWellLasVegas.com.